All right, let's talk about a condition with a pretty intimidating name, ankylosing spondylitis. We'll just call it AS. So what is it? Put simply, it's the kind of arthritis, one that creates chronic inflammation, mostly in the spine, and that leads to some serious pain and stiffness. We're going to break down what that really means and what it feels like.
Okay, let me start by asking you a question that sounds, well, kind of backwards. Does your back pain actually feel better when you move around and exercise, but get worse when you sit still or try to rest? If you find yourself nodding your head right now, you've just hit on a huge clue that separates this kind of pain from your everyday backache.
Right, so this is way more than just your typical, I slept wrong or I lifted a heavy box kind of pain. With AS, the problem is driven by inflammation that's coming from inside your own body. And that's exactly why the pain behaves so weirdly. Getting your head around that is really the first big step to understanding this whole condition. So let's put these two types of back pain side by side. In one corner, you've got inflammatory back pain, which is the signature of AS. It tends to sneak up on you, usually before you're 40, and here's the kicker. It gets better with activity. You might even wake up in the middle of the night feeling stiff as a board, but once you get up and move, it eases off. Now in the other corner is mechanical back pain. That's the one we all know, where all you want to do is lie down and rest. See? They're total opposites. So, what is actually happening deep inside your body to cause this very specific kind of pain? Well, it all boils down to one word, enthesitis. This is the real heart of the problem in AS. It's inflammation happening at the exact spot where your ligaments and tendons anchor themselves to your bones. Just imagine the anchor points for your muscles being inflamed and irritated all the time. That's where that deep, persistent pain and stiffness comes from. And here's the thing. Because AS is a body-wide or systemic condition, that inflammation doesn't always stay put in the spine. Nope. It can pop up in some really surprising places. For instance, you might see something called dactylitis, where an entire finger or toe swells up and looks like a little sausage. Or you could get this really painful eye inflammation called uveitis, which happens to a lot of folks with AS. The inflammation can even be tied to things like inflammatory bowel disease or psoriasis. Okay, so this leads to the next logical question, right? Who tends to get AS and what's causing it? Let's take a look at the patterns and the science behind who's most at risk. Now get ready for this number because it really tells a story. A whopping 80% of people with AS feel their very first symptoms before they even turn 30. So let's be clear, this is not a condition of old age. It usually shows up when people are in the prime of their lives, just starting their careers or families. So what's the common link for so many of these people? Well, often the answer is in their DNA, specifically a genetic marker called HLA-B27. Now, and this is super important, just having this gene does not mean you're destined to get AS. In fact, most people with the gene never do. But it is a major risk factor. Think of it less like a guarantee and more like a genetic predisposition. And this genetic marker isn't distributed evenly across the board. If you take a look at this chart, you can see how the prevalence of HLA-B27 changes with ethnicity. For example, in the US, it's found in about 7.5% of non-Hispanic whites, which is quite a bit higher than in other groups. And that little piece of data helps explain why the rates of AS itself also vary among different populations. Okay, so we've got all these clues on the table. The unique pain that gets better with movement, the other possible symptoms popping up, and this strong genetic link. So how on earth does a doctor connect all those dots to officially make a diagnosis? Well, the diagnostic trail almost always leads to one key area, the sacroiliac joints. That's the spot where your spine connects to your pelvis. Inflammation right there, which has a name, it's called sacroiliitis, is the single biggest clue doctors are looking for. If they can see clear evidence of it on an X-ray or an MRI, well, that's pretty much the smoking gun. What's really fascinating is that you can watch the story of AS unfold through a series of X-rays. The first chapter often starts with a really subtle change called squaring. Normally, the front of your vertebrae have this nice little curve to them. But with chronic inflammation, they start to flatten out and look more like blocks. That's one of the earliest signs. So, as the story moves along, the next thing a radiologist might spot is something called shiny corners. Remember that enthesitis we talked about, the inflammation at the anchor points? This is what it can look like on an X-ray. The body is trying to heal the damage right at the edges of the vertebrae, and it creates these small, dense patches that look, well, shiny. And then, in the final chapters of this radiographic story, in late-stage, untreated disease, you can get the classic bamboo spine. You can see it so clearly here.
The body has actually built little bony bridges between the vertebrae, fusing them all together. It's not hard to imagine how this leads to that profound stiffness and loss of motion.
Now, I know seeing an image like the bamboo spine can be really alarming, but here is the most important thing to remember. That is a late-stage finding from an era before modern treatments. The story does not have to end there. In fact, the entire goal of treatment today is to prevent that from ever happening and to help people with AS live full, active, and thriving lives.
So, how do we do that? The pharmacological game plan usually starts with NSAIDs to get that inflammation under control. But if those aren't enough to do the trick, doctors have some amazing tools now, like a powerful class of drugs called TNF inhibitors. These are biologic medicines that are incredibly targeted. They go right after the specific parts of the immune system that are causing all the trouble. But, and I cannot stress this enough, medication is only one piece of the puzzle. What you do for yourself every day is just as important, if not more so. Regular exercise and physical therapy, they're absolutely non-negotiable for keeping your spine mobile and managing pain. Working on your posture is crucial too. And because AS can affect your ability to take a deep breath, quitting smoking is one of the best things you can possibly do for your overall health. Look, managing a chronic condition like AS is definitely not a solo sport. It's a team effort. And you get the best results, by far, when you have a whole dedicated team of professionals in your corner. Think of your rheumatologist as the head coach of your team. They're the ones coordinating the overall game plan. But they work with a whole roster of players: your primary care doctor, your physical therapist, who's like your personal trainer, and any other specialists you might need. If you have eye inflammation, an ophthalmologist joins the team. Gut issues? You call on a gastroenterologist. It's this collaborative, all-hands-on-deck approach that truly works best. So where does all this leave us? The reality is the outlook for someone diagnosed with AS today is brighter than it has ever been. With amazing treatments and a strong support system, the whole conversation has shifted. It's less about what the disease might do to you and so much more about what you can do for your health. So the question I'll leave you with is this: what is the most important step you can take on your health journey starting today?